Hello, I am Monica Smith. I'm a physical therapist here at Avista Adventist Hospital, and I'm here to talk to you about exercises, strengthening, getting ready for your joint surgery that's coming up. The stronger you are, the more prepared you are for this surgery, by far the better you're going to do after this surgery. So we're going to go through the exercises that are in your booklet. Hopefully you all have your booklet at home. The exercises we're going to go through they start on page 25 with pictures and instructions on page 26. So these exercises can be done in a recliner, on a bed, on a couch, somewhere where your legs are straight out in front of you. So I'm going to demonstrate them up here. This first exercise is just an ankle pump. Really no wrong way to do this exercise. You're going to make sure those feet are moving. This is going to make sure that you keep blood pumping in your legs, so that keeps the risk of blood clots low. It's also going to help pump swelling out of those feet, out of those legs, which can sometimes happen after a joint replacement. So this is just going to help keep you more comfortable and helps prevent blood clots in a pretty easy way. So nice and easy ankle pumps. Your next exercise, you want to get those knees as straight as you can, and you're just pressing those knees straight. You might even notice your heel come off the ground a little bit or off the bed, and that's okay. That's not a bad thing. You are just strengthening these good quadricep muscles. You're going to hold it for a second or two, long enough for those muscles to engage, and then relax. On these squeezing exercises, do not hold your breath. They're not about big strengthening. They're just making sure these muscles are working well. All right? Your next exercise is a butt squeeze. This one, you're squeezing your cheeks together, just like you're cracking walnuts back there. All right? Again, you're not holding your breath. You're just squeezing, making sure those muscles are engaged, and then relaxed. And you're going to do 5 of those. Your next exercise is called a blanket roll squeeze. Here at the hospital, we just roll up a blanket. At home, you can do the same thing. You don't need to worry about any special equipment. Roll up a blanket. If you have a ball at home, a foam roller, anything from about 4 inches in diameter up to about 12 inches in diameter, you're going to put that between your knees, and you're just going to squeeze those knees together. All right? Sometimes I have people ask me, should my whole leg be coming in, or am I just rotating in? And really, they're both just fine. So don't worry about it. You're just going to keep those legs straight, and you're going to squeeze together. Again, you're going to hold for a second or two, and then relax. All right, your next exercise is called a heel slide. Before you have surgery, you don't need to worry about a belt. After surgery, you're going to use the belt to help you with this exercise. The purpose of this exercise is for good range of motion of that new joint, so a knee or a hip. So you're going to take your belt that we give you when you're here. And again, if you want to use something at home, you can use a yoga strap or just a belt that you put around your pants. You're going to put it around your foot. You're going to hold on to it right around your knee. If it's too high, it's just too hard on your arms. You don't have enough room. So hold lower, right around your knee joint, and you're going to pull on that belt, and you're going to bend that knee and the hip. All right? So before surgery, you're not going to have hip precautions yet. So you're not going to worry about that. You're just going to bend gently and slowly. After surgery, if you have hip precautions, you're not going to go as high, but it's still very important to keep those joints mobile. It moves the good fluid in, the bad fluid out. A stiff joint is just a painful joint, so we want to keep those joints moving gently, and that's why I want you to do this exercise after surgery, only with the belt, because it's not about strengthening with this exercise. It's all about gentle motion on those joints and keeping things mobile and moving. All right? Your next exercise is on the next page. and it's called a knee extension stretch. In the booklet, it says for knee replacements only. I think this is a great exercise for anybody because it's really going to stretch out all those tissues, the muscles, anything behind your knee that might be a little too tight. It's most important for our knee replacements, but it's going to benefit everyone. So you're going to put something behind your heel, like that blanket roll we were doing earlier. You're going to have nothing behind your knee, and your knee is just going to relax down, let gravity pull it straight. After surgery, this is so important because we want that knee to be straight. If you don't work on getting that full extension back, then you're going to be walking around with that knee bent, and you don't want that. Good, strong, straight knees. If you are having hip surgery, then it's not as important except that you are getting a good hamstring stretch. So it's beneficial for both. This last exercise that we're going to talk about, you're only going to need to perform this before surgery. This is one of my most favorite exercises there are without any special equipment, so it's great for doing at home. It strengthens every muscle that you have from the top of your head to the tip of your toes, again, without any special equipment. You will need a sturdy chair, and a chair with arms is ideal because this first part of this exercise is basically a chair push-up. So you're going to put your hands on the armrests of the chair. You're going to lean forward and you're going to push yourself up and slowly lower down, really strengthening those arms and your chest. I am trying not to use my legs on this one because I really want my upper body to get stronger. After surgery, you're going to be using a walker or crutches, something to help you along. After a joint surgery, you just need something, again, a walker or crutches, to support that new joint that you have. So your arms and your chest and your back are going to be helping you walk. And most of us aren't used to having to do that. So it's just going to take a lot more strength of your upper body, even for walking. So making sure that part of your body is strong is important. It's also going to help you getting off of a low chair, out of a low car, all of those kind of things if your upper body is strong. Now the next part of this exercise that's not described in the booklet is going to be for strengthening from your waist on down to your feet. So I'm going to try not to use my arms on this last part. If you do need to use your arms a little bit, obviously that's fine, but really try to focus on your legs, your butt, to really do most of the work on this one. So next, you're going to make sure your feet are on the ground. You're going to lean forward, and you're going to slowly stand up, and then slowly lower down. So sit to stand is sometimes what we call this, or basically it's a squat, but in a nice, safe, seated position. All right? When you go to sit back, I want you to really make sure that your butt is going back into that chair and keeping the pressure off your knee joints. That's just going to hurt the front of those knees if your knees are too far forward over those feet. So standing up, make sure when you look down, you can see your toes, and especially when you go to sit down, that your butt is really aimed back towards the back of the chair. So this is the only exercise of what we just went through that is for before surgery only, and you won't do this one again after surgery. This is your most important exercise to do before surgery, again, because it's just going to provide some great strengthening so that you can be prepared as possible for this surgery. Next thing I want you to do is to walk around your house. I want you to pick up throw rugs that maybe are loose, that have a curling edge on them. Sometimes your walker can get hung up on those things, so picking those up can be very helpful. If you have extension cords going across hallways or pathways, pick those up temporarily. You also might want to really look around and find a chair that you feel like is not too low, not too soft or squishy, especially if you're having a total hip replacement with the posterior approach. Sometimes one of your precautions after a hip replacement is we don't want you to bend that hip past 90 degrees. Well, if you're sitting on a really low, soft, squishy couch and you really have to lean way forward to get yourself up and out of the chair or the low sofa, that's going to be pretty tough on that hip replacement. So find something comfortable that you can watch television in or read a book, something that, again, is not too low and soft and squishy. So as I mentioned earlier, you're going to need a walker for after surgery. Hip replacements, knee replacements, it will not be for very long, but you will need it temporarily. So if you are going to buy one, borrow one, rent one, make sure it's one that will fit you. They're all adjustable, as you can see by the pins down here, but they're all adjustable only within a range. So when you go to get the walker that you are hoping to use, make sure you stand inside the walker, put your hands down to the sides. You want the crease of your wrist to align with the handrest of the walker. So then when you go to put your hands on the walker, you have a little bit of a bend in the elbow. This will allow you to push on it a little bit, take some of the weight off your legs, off that new joint. But I also don't want it so short that you're locking out your elbows, your wrists, your shoulders. That'll just lead to other joint problems. We don't want you to have any of those. So again, we want you to make sure that your walker is going to be the right height, not too tall, not too short. We want it to be sturdy, so take a few steps with it. And it also works best if it has the wheels on the front and none in the back. So a two-wheel walker or a front wheel, or a front-wheeled walker. That means then that you can just push it along like you would a shopping cart when you take steps. Rather than a walker without wheels, you have to pick it up so there's nothing on the ground, place it down, and then step, step. This does not lead to a good natural gait after surgery, and it also is less stable. So even if the wheels might feel a little precarious to you, it's actually a lot safer. The walker never leaves the ground. You're just pushing it along and you're stepping into the walker. So find yourself a good sturdy walker. Again, many can be found at thrift stores, at rec centers, community centers, and sometimes even neighbors just have them around from a previous procedure that they might have had. So ask around and get that equipment that's going to help you after surgery. If you have stairs at home, we recommend a cane or a crutch, as a walker cannot go on stairs. So if you have a flight of stairs or even just a couple stairs to get into the house, find a single crutch or a cane or a walking stick, as that will help you manage stairs. Most stairs at someone's home does not have railings that are close enough to each other that you can use both railings at the same time. So again, that's why we recommend a railing and a crutch or a cane. So find one of those for home use as well. A cane or a crutch will also be great when you're ready to transition off of the walker. We don't typically like you to go from a walker to nothing. If you go walker to nothing, sometimes you'll have a little bit of a gimp, a little bit of a hitch in your gait. And we want you walking beautifully. We don't want those muscle patterns to be built where you're kind of got a limp going on. So using a cane or a crutch when you're done with the walker can help with that, those nice motor patterns, those nice gait patterns that we want you to have and that you want to have after surgery as well. So get yourself ready for this surgery, get your home ready for this surgery. The more prepared that you are for this surgery, the easier and better your recovery will be for afterwards. I appreciate you watching this. I look forward to meeting you after your surgery and helping in your recovery process. Thank you.